Medication impacts physiological processes and is given to prevent, diagnose, cure, treat, or relieve symptoms of disease. Medication administration requires an understanding of medication safety principles and practices. Professional practice expectations require medication administration be evidence-informed, adhere to legislation, and follow practice standards. Nurses are required to demonstrate self-awareness of the limits of their own knowledge, skill, and judgment, and get help as needed. They do not perform medication practices which they are not competent to carry out. Nurses consider the client, the environment, and the medication. They identify factors which influence medication action, such as age, gender, diet, illness, ethnicity, and timing of administration. They take into account agency policy, practice resources and supports, and technology and systems. Medication information can be obtained using a reliable nursing drug reference. The reference lists a drug's action, what it can be used for, dose and route, side effects, and warnings. It describes nursing considerations, for example, whether blood pressure must be taken before given the medication, or if the medication must be taken with food. Medications are pharmacologically designed to enter the body 4 ways: enterally, parenterally, topically, or through inhalation. The specific route of administration will be specified by the prescriber, and the nurse may not change the route without a medical order. Each route has specific policies and procedures, precautions, and directions the nurse must follow. When administering medications, nurses must apply standard precautions and routine practices. Hand hygiene is performed before medication administration and between patients. Hygiene includes hand washing and the use of hand sanitizers. Medication should not be handled, and, if contaminated, they should be disposed of according to agency policy. Proper handling and disposal of contaminated equipment is important. For example, do not recap used needles and dispose of sharps in designated containers. Gloves are recommended when there is a risk of exposure to a medication, for example when applying a topical cream, or when there is risk of exposure to blood, body fluids, secretions or excretions, for example when giving an injection or administering medication via G-tube. The nurse obtains and sets up the appropriate equipment needed for medication administration. Interrupting the med-admin process for any reason, including forgotten equipment, increases the risk of error. There are 10 rights to safe medication administration: right medication, right dose, right time, right route, right patient education, right documentation, right to refuse, right assessment, and right evaluation. Right assessment is completed to identify required baseline data, such as pulse rate or blood glucose level. The nurse educates the patient about the medication, for example what the medication is for and whether it must be taken on an empty stomach. The nurse listens to the patient and is aware the patient has the right to refuse a medication. The medication must be given to the right patient. Patient identification is checked using 2 accurate objective methods. The medication must be administered at the right time. The traditional accepted rule is no more than 30 minutes before or after the time stated. Carefully check agency policy, as the Institute for Safe Medication Practices has recommended some newer guidelines. 5 rights: right client, right medication, right dose, right route, right time, are completed while preparing the medication. Each right is checked 3 times. These 3 safety checks must be performed to reduce the risk of error. The first check on the 5 rights is done immediately after the medication has been obtained from the storage system. The second check is completed prior to pouring the medication. The third check is performed prior to returning the packet, box, bottle, or container to the medication storage system. The nurse should never leave the medication unattended and must keep the storage system locked when not beside it. On each of the 3 checks, the nurse compares the medication administration record to the medication itself to ensure right patient, right drug, right dose, right route, and right time. The nurse verifies the medication has not been changed or discontinued or already given, and checks for an order expiration date present on some medication orders. After administration, the nurse documents the medication was given. The nurse evaluates the medication's effect on the patient and documents this as well.